What percentage of your practice is women? Probably 70, maybe even 80%. And if that's the case, then how specific is the framework that you're using diagnostically to a woman's health? How would you gauge your understanding of gynecology as a specialty practice in the context of Chinese medicine? And what do you have specifically in your toolkit that directly corresponds to women's health issues, the issues that are affecting the large majority of the patients entering your clinic each week? In many cases, simply applying the principles and treatment strategies of general practice is not enough to address the complexities of women's health. What is required is a deep understanding of gynecology as a specialty, to have our principles, diagnoses, and treatment correspond directly to the unique physiology of a woman's body. Chinese medicine has a long history of gynecology, of seeing gynecology as a unique area of study and practice, and has developed many different models, strategies, and a whole host of approaches that are not part of the general practice of TCM. For example, in this course, I teach a specific pulse diagnosis system and a way of looking at the tongue that is specific to gynecology. The course consists in over 50 lessons on diagnosing and treating the most common conditions that we see in clinical practice today. Everything from painful periods to menstrual block to complex conditions like endometriosis and PCOS. I provide detailed treatment strategies for shrinking fibroids and cysts. We cover menopause and effective treatments to help women with the most common symptoms that occur at this transition. These videos can be watched at your own pace. In addition, we gather 6 times online over the 3-month course. These are 90-minute sessions dedicated to answering all of your questions and discussing difficult clinical issues. Each time we meet, we will have a case study from your practice so you can get my direct help and feedback with your challenging cases. We refine tongue diagnosis skills, clinical reasoning, and the course lessons really come to life with this real clinical practice. My passion is helping other practitioners clarify their thought process and clinical intuitions into coherent diagnosis and clear, effective treatment strategy. This is what this course is all about: better health for women in your clinic, and eliminating frustration and expanding the joy you have in treating them. I hope you join me.